After your heart surgery, it is important to keep your heart healthy by following a healthy lifestyle. Risk factors for heart disease include smoking, high blood pressure, being overweight, high cholesterol, diabetes, and stress. These risk factors can be reduced by making lifestyle changes and taking medications as prescribed. Let's discuss some of the ways you can make healthy lifestyle choices. If you haven't already quit smoking, please talk to your doctor or pharmacist about methods to help you do so. If you quit smoking prior to surgery, do not start smoking again. Exercise is an important piece of cardiac health. Continue your walking program outlined by your physiotherapist with a goal of walking for 30 to 60 minutes most days of the week. For further information, refer to the activity section of this video. Recovering from heart surgery and adjusting to everyday life is a big challenge for your body and your mind. You may feel anxious, frustrated, or depressed after your heart surgery. These feelings are normal and can last for a few days to several weeks. If these feelings last longer than 2 weeks, you should speak with your family doctor. Reducing stress is also important. There are resources regarding reducing stress levels listed in the resource section of your heart surgery book. Achieving and maintaining a healthy weight can reduce your risk of heart disease. Speak with your healthcare provider about your healthy weight goals. Ensure you are setting realistic and attainable goals for yourself. If you're the type of person who enjoys cream in your coffee, try switching to milk instead. Explore healthier alternatives to some of your favorite high-fat or high-cholesterol foods. Familiarize yourself with what heart-healthy fats are and substitute them into your diet while also ensuring you're not exceeding the recommended daily intake of fat. The object is to eat a heart-healthy diet that is an improvement from the diet you were routinely eating before your heart surgery. Be sure to celebrate the small successes and create new goals for yourself on your journey to a heart-healthy lifestyle.
You may have decreased appetite after surgery. This will improve as you begin to feel a bit better. Eating small, frequent, healthy meals or snacks will help you get the nutrition your body requires to heal. Fluids may have been limited while you were in hospital, but you can drink normally once you return home unless you've otherwise been instructed. If you have diabetes, monitoring your blood sugar and following a balanced diet is very important to promote healing. We suggest a balanced, heart-healthy diet that includes eating more fruits and vegetables. Try to fill half of your plate with vegetables at every meal and every snack. Frozen or canned, unsweetened fruits and vegetables are a perfect alternative to fresh produce. Choose whole grain foods more often. This means choosing whole grains instead of processed or refined grains like white bread or white pasta. Examples of whole grain foods include whole grain crackers, brown or wild rice, quinoa, oatmeal, and hulled barley. Eat a variety of foods that provide protein and try to incorporate more plant-based protein options. These include things like lean meat, fish, beans and lentils, tofu, as well as dairy products. Try to eat 2 servings of fish per week or incorporate plant-based sources of omega-3 fatty acids in your diet, like ground flaxseed, hemp hearts, chia seeds, or walnuts. Choose lower fat and unflavored dairy products. 0 or 1% milk fat is appropriate here. Use a small amount of the right kind of fat. Unsaturated fats like olive oil and avocado oil, as well as some nuts like almonds, pistachios, cashews, pecans, and hazelnuts are all great options. Do your very best to limit saturated fats. These are the fats found in animal products, most dairy products, and plant-based products like palm and coconut oils. Try to avoid trans fats altogether. These can be found in foods like shortening, commercial baked goods, and deep fried foods. Limit heavily processed foods as these contribute extra salt, sugar, and preservatives in our diet. Examples of these sorts of food include fast food, hot dogs, chips, cookies, frozen pizza, and deli meats. Some minimally processed foods are okay to include in your diet, like bagged or frozen vegetables and fruit, flour, dried herbs, tofu, or milk, for example. Preparing and eating most of your meals at home is a really easy way to limit your intake of overly processed foods. Limit sodium intake to less than 1 teaspoon a day, or 2,300 milligrams. Choose less canned and processed foods more often, and limit adding salt to foods. Limit added sugars. These include sugary drinks like pop and energy drinks, and try to make water your first choice when it comes to beverage. Limit alcohol to 1 drink a day for women and 2 per day for men. And most importantly, if you don't drink, don't start.